And to hopefully brighten up our day on St. Swithin's Day with the rain falling is Anneliese of the Health Hub Times Square in Ballincollig. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
Do you think it'll rain for 40 days?
Oh God, I hope not.
We'll keep our fingers crossed.
I really do. It did last year.
It did.
Yeah.
Okay, let's get straight into questions. And I'm going to put two together because they're kind of similar. They're both to do with cholesterol. A listener says, I've been on Lipitor for cholesterol for the last 6 months. I feel I have general aches and pains from it. Is there a natural alternative? And somebody else says, Patricia, could you ask Anneliese for advice on high cholesterol? I've tried red yeast rice with CoQ10 for the last 12 months and it didn't make a difference. My cholesterol is still high. All my other bloods are good. I exercise. I'm a non-smoker. I'm not overweight. Anything else I can do is probably hereditary, as my mother was on statins. And you will hear that from people who say, don't have a weight problem, eat a healthy diet. High cholesterol can be hereditary, can't it?
Absolutely, it can be, Patricia. And for the people where it is hereditary, the statin is a miracle drug. It really is, because it works so well to keep cholesterol down. So if there is a family history of early onset heart disease or high cholesterol at a younger age, I mean, it's quite normal. We all, as we age, get a bit of high cholesterol when we're older. But I mean, if you've got family history of high cholesterol in 50s and 60s, you do need to be on the statin drug from that age. I think the problem is that it's given to everybody, and a lot of people probably could do without it and manage cholesterol and their heart health with diet and natural approach and avoid the side effects. But for those people who need the drug, it is a lifesaver.
But if it doesn't suit them, like the listener who's got the aches and pains, which is very common.
Exactly. So you can take something. One of the biggest problems with the statin drugs is that they work by blocking a pathway in the liver that makes cholesterol from saturated fat. Which, because we need cholesterol, it's part of our sex hormones, it's part of our anti-inflammatory hormones, it's a very important part of the protective fatty tissue that surrounds our nerves in our brain. So we do need it and we do make it. But for some people, they make too much. So by blocking that pathway in the liver, it brings your cholesterol down. It also blocks the production of a very important vitamin called coenzyme Q10, which is integral to the energy pathways in every single cell in our body. So if your cell is deficient and not able to produce enough energy, you will get things like pain because your muscles won't be able to work properly. You might get a bit forgetful because your brain might be suffering a little bit. So in order to counteract the side effect of the statin drug, you can simply take the coenzyme Q10. So for those people who do need to be on it, don't worry about it. It's a life-saving drug. Just make sure that you're counteracting the possible side effects by taking the coenzyme Q10. And I always think taking a fish oil as well is another lovely heart-healthy one for people with a family history of high cholesterol and heart disease, because it does keep your good cholesterol up and it also keeps your blood lovely and thin, and it does have an anti-inflammatory effect, so it benefits your heart in many ways. So if you take the drug, take the two of those. And then for people who don't want to take the drug and don't have the family history, the red rice yeast can work very, very well. But if you've been taking it for 3 or 4 months and your cholesterol doesn't go down, you're going to need the drug.
Okay, there's no other way around it. Okay. Hi, Patricia, could you ask Anneliese any advice on hiatus hernia, recently diagnosed, and how did it come about?
So a hiatus hernia is where a part of the diaphragm protrudes through so there's a pipe that goes down through the diaphragm, and the stomach pipe goes down through that. And then if for a hernia, that becomes weakened and the stomach can protrude up through that little hole and get caught, and it can be very, very painful. For most people, the solution is surgery, but it's not always very successful. So if you can manage it without surgery, that's the ideal. And there's really not too many natural things you can take for the hernia itself, like stress and strain, lifting, Patricia. That would all put pressure on it. I find myself that people who've had a long-term history of IBS, they're more likely to be prone to getting hiatus hernias. So to deal with it, what I normally recommend is that people eat little and often. So don't put a lot of stress on your stomach by putting large amounts of foods in. So have 6 meals a day as opposed to 3 large meals and maybe a couple of snacks. So try and break that up. Make sure you chew your food very well. Take a digestive enzyme, which will help with digestion, and again, take pressure off the stomach. Just get a general one. And then you could also, if you're getting a lot of reflux reflux from it, a lot of acid reflux, you could take zinc carnosine, which can help tighten up the little valve at the top of the stomach and prevent the acid from being pushed up into the stomach pipe. So that would be my advice. There's another thing as well. I don't know how well it works, but I read it somewhere once, Patricia, that if you are feeling the pain of the hernia, if it has started kind of protruding up through the diaphragm, drink a big glass of water, stand on the second or third step of your stairs and jump off, and the weight of the water in your stomach will help pull it down. So you could try
Worth
that
the try.
as well.
Worth the try, but just be careful, don't fall. Okay, hi. Question for Anneliese, please. My grandson is having a very serious knee operation. It's going to be at the end of this month. Is there anything Anneliese could recommend for him to take to prepare ahead of this operation?
I think the biggest thing really in terms of preparing for a surgery, Patricia, is to support your immune system, because you don't want to go into hospital for one thing and end up getting something worse. And a lot of things that you take as well may interfere with your ability to have surgery. So you need to be careful. Like, for example, you wouldn't want to take anything that would thin your blood, because that would definitely impact your ability to have surgery, or would not be safe for surgery. So I would suggest taking something to support the immune system. So I love the Nature's Plus Immune Boost. It's got loads of stuff in there: vitamin C, vitamin D, zinc, selenium, vitamin A, NAC, and they're all really, really supportive for the immune system, and they'll do no harm whatsoever. So something like that to support the immune system. And then really the key is for recovery. So for recovery of that, I would definitely have homeopathic arnica available that you could start taking as soon as the surgery is done. You can start taking that. You can also rub arnica on, but if the skin is broken, that's not suitable. So that's why taking it is really good. And continue with the immune support afterwards. And a vitamin C and zinc is always wonderful for skin healing. So that will help with scarring and with the tissue for it to knit back together again. So the combination of arnica, vitamin C and zinc is great for anything after surgery, and for bones as well.
Hopefully he'll bounce back really quickly. Hi, Anneliese. Unfortunately, my mother is finding it very difficult to stay away from salt when having her dinner. Could you suggest any alternatives that would be safer for her health? She's not keen on pepper.
Okay, so you can get salt alternatives, and a lot of them have seaweed in there, and I suppose they also are a little bit salty in of themselves. The Dr. Vogel does a range of low salt sprinkles that have seaweed, a little bit of salt, but lots of herbs as well. So they're very flavoursome, and they can make you crave the salt far less. The other thing you can do is you can buy actually potassium chloride, which is a type of salt. It's not like sodium chloride, so it won't have the same huge effect on your blood pressure. But I think it'd be much better if you could use the natural salt, because we do need some of it, with the flavourings. And then if that doesn't work, potassium iodide, they used to sell it as iodized salt in the supermarkets. I haven't seen it for a long time, Patricia, so I don't know if it's still available, but that would be also another alternative.
Yeah, and it's very hard if you like salt on your dinner or on your food. It's very hard to give it up, isn't it?
Absolutely is. And I mean, it's a complete habit as well, because a lot of us salt our food even before we don't eat it. So I think taste the food first. Don't salt the food when cooking, and then people can add their own salt. But we use those at home, and I'm a lover of salt myself. So we use the Dr. Vogel mixes at home. Dr. Coy's do one as well, and they are delicious.
Okay.
If I go to Germany, I bring them back as well, because you get a lovely flavour without needing too much salt.
Yeah, I remember interviewing a chef once who said it's the bane of a chef's life to look out into a restaurant and they've just served food, and particularly soup, and somebody straight away picks up the salt, and he said you taste it and then decide whether you need to add salt or not. But it's, as you say, it's habit.
Habit, exactly.
Yeah, we just pick it up. Okay, hi. Could Anneliese suggest anything for pain relief? It's pain because of a disc leaning on a nerve in my back. Ouch.
Unfortunately, no. To the problem there, it's a structural issue. So the disc is inflamed and bulging and trapping the nerve. So the key to that, obviously, is to get the disc off the nerve. Natural will take a very long time. Like, you can take natural anti-inflammatories like turmeric and boswellia. You can take joint support, things like collagen and cartilage, and they will all help in the long run. They'll help prevent the other discs from getting to the state of disc repair where they do bulge, but it's not going to give you any instant relief. So I don't know where the pain is. I know for a lot of people, when that happens, the pain goes down their legs. So you can actually get an injection into the piriformis muscle of the bottom, and that will block the pain going down the leg. It's very, very good, and it does give you time to heal as well. But that's better for sciatica, and I don't know if this is a sciatica problem with the disc or if the disc is further up trapping another nerve. So unfortunately, I would say no fast fix, but definitely the things I mentioned, like the collagen, the boswellia and the turmeric and all of those natural ones will help in the long run.
Okay. Also, can you... Where's this question gone? Sorry, there's so many texts coming in. Could you ask Anneliese, please, could you recommend anything for strawberry gallbladder? What's strawberry gallbladder?
I have never heard of that, Patricia.
Yeah.
So now it makes me think if strawberries are kind of pitted with loads of little stones. So I wonder, is there lots of little gallbladder stones? But generally, the gallbladder is a reservoir for our bile, which we need to help break our fat down in order to be able to digest it. And you can build up stones. So things that are very healthy for the gallbladder, there's a lovely product we have in the shop here. It's called Taracyn, Taracyn, and it has got a number of different things in there that are there's anti-inflammatories to bring down inflammation in the gallbladder, and there also is components that make up bile to help you flush your gallbladder. So maybe that would help. The other thing as well, if you're suffering symptoms, taking a digestive enzyme that has got a lot of fat-digesting enzymes in there will really help, because that's one of the problems, Patricia, is that nausea when your gallbladder is acting up. And I know that BioCare do an artichoke and lipase complex, lipase being the enzyme that breaks down lipids and fats. And if you take that with your meal, you should really notice far less nausea and a much better ability to be able to break your fats down and digest them.
Okay. All right. We'll leave it there. Thank you for that, Anneliese.
Thanks, Patricia.
And we'll talk again next Monday. That's Anneliese Dressel of the Health Hub Times Square in Ballincollig. And Anneliese will put up all the information that she imparted with us today on her website later on this afternoon, which is healthhubstore.com. It'll be as heard on the radio.